Welcome to Happy Nursing. This is Ila. In our previous video, we discussed the events and risk factors in pregnancy and health education for the mother in brief. Today we will discuss something related to the newborn. As soon as the baby is born, a drastic change occurs in his environment because till date he was in the mother's womb in a controlled environment and warmth. Suddenly his surrounding temperature falls, environment changes. Baby can suffer from hypothermia due to this change of temperature. Baby can be cyanotic due to lack of oxygen in the organs. He may need resuscitation or only a little oxygen support. So how will we identify the needs of the baby at this point of time? Whether he needs to be kept in a warmer or in normal cot with the other babies, whether he needs full ventilator support or moist oxygen inhalation only. In order to know this, we have to do a number of assessments. One of those is calculating APGAR score, our today's topic. It was developed by an anesthesiologist, Virginia APGAR, at Columbia University in 1952 as a standardized way to evaluate even infants shortly after birth. It is done at 1 and 5 minutes after birth of the baby. APGAR stands for appearance, pulse, grimace, activity and respiration. For each criterion, newborns are given a score from 0 to 2 and lastly they are added up to know their full APGAR score and implemented accordingly. We will look into each one of these criterion in detail. First of all, appearance. Appearance means how the baby looks to us. We generally assess that by looking at the skin color. If it's blue or pale all over the body, we will give a score of 0. If it's blue only at extremities but the body is pink, which is called cyanosis, then a score of 1 will be given, and if it's pink all over the body including the extremities, then a score of 2 will be given. That means the baby is healthy, no cyanosis is present. Next field is pulse, which we get by assessing the heart rate. If no pulse is there, it means a score of 0. If a pulse is there, which is less than 100 beats per minute, then a score of 1, and if it's equal to or more than 100, then a score of 2 will be given. That means the baby's pulse is adequate. The normal pulse rate of a newborn should be 120 to 140 beats per minute. Our next criterion is grimace. The literal meaning of grimace is such a facial expression which is either of disgust, disapproval or pain. In case of a newborn baby, although he is not able to understand all these feelings right now, but he will have a response to stimulation such as mild pinch. We call this reflex irritability. If the newborn doesn't respond at all, a score of 0 is given. If there is grimacing like face on suctioning or mild stimulation like touching or pinching, a score of 1 is given, and if the baby cries loudly on stimulation, a score of 2 is given. Next comes A for activity, which is evaluated by assessing the muscle tone. We have to look at the resistance to muscle movement. For example, if the baby's arm is pulled outside or extended, we have to see whether it gets flexed back or not. If not, means if there is no resistance at all, a score of 0 is given. If slight flexion is there, score of 1, and if the arms and legs are already flexed from before and strongly resists against extension, then a score of 2 is given. Okay, we are left with our last criterion, that is respiration. Here respiratory effort is to be checked if at all it is present. If not, then a score of 0. If weak and irregular respiration, which generally happens when the baby is gasping, a score of 1, and if strong respiration along with a loud cry is present, then a score of 2 is given. At the end, the scores are summed up. Scores of 7 and above are considered as normal, 4 to 6 fairly low, requiring medium interventions like oxygen support, suctioning or some amount of stimulation like rubbing the baby, etc. and 3 or below are regarded critical, requiring full resuscitation. The test may be repeated again after doing it at 1 and 5 minutes of birth if it is low. For example, a low score on the 1 minute mark may show that the neonate requires medical attention, but if it improves at the 5 minute mark, that does not indicate a problem at that point of time. APGAR's test should not be used to predict long-term health issues. Its purpose is only to determine shortly whether a newborn needs immediate medical care after birth or not. Now, an important aspect to keep in mind is that we have been saying from the very beginning that babies scoring 3 or less than that will need resuscitation. But resuscitation is a process where we oxygenate the baby's vital organs, which if not done can cause death. So, the process of resuscitation cannot wait even for 1 minute. We should not wait for that till someone checks the APGAR score. Resuscitation should be started as soon as the baby is born if needed. Therefore, the 1 minute APGAR score is not used to determine if initial resuscitation is needed or not. Rather, it is used to determine if resuscitation effort should be continued or not. And the 5 minute APGAR score should be used to assess whether the baby is responding to resuscitation or not. Now, according to the neonatal resuscitation program guidelines, if the score is below 7 at the 5 minute mark, it should be reassessed at 5 minutes interval for up to 20 minutes. I have arranged the format of APGAR score in a tabular form here for making it easier to understand. Let's have a look once again. A stands for appearance, which we assess through skin color. P stands for pulse, which we assess through the heart rate. G for grimace, which we assess through reflex irritability. A for activity, assessed by muscle tone, and R for respiration, where we have to look for the respiratory efforts. If the skin color is blue or pale all over, score is 0. If blue at extremities, body is pink, score is 1, and if it's pink all over, score is 2. In the pulse, if no pulse is there, score is 0. If pulse is less than 100 beats per minute, score is 1, and if it's equal to or more than 100, score is 2. In reflex irritability, if the newborn doesn't respond at all, score is 0. If there is grimacing, score is 1, and if the baby responds through a loud cry, score is 2. In activity, no resistance means score of 0, slight resistance means score of 1, and strong resistance means score of 2. Lastly, respiration, absence of which means score of 0, weak and irregular respiration means 1, and loud cry representing strong respiratory efforts means score is 2. After we are finished giving scores, we have to sum up and evaluate according to the next table. Babies scoring 0 to 3 are considered as critical, needs intensive support. 4 to 6 not critical, but they need interventions specific to their symptoms, and 7 to 10 are considered normal and healthy. No special intervention is needed for them, just the routine care. I hope you have enjoyed the video. If you like this video, like and subscribe to my channel. Thank you for watching.